Johanna, your birds are so amazing.
I'm wearing headphones, so I'm surprised you can still hear them.
It's
Through the
very
mic.
relaxing. I like it. Here we mainly get seagulls on the roof, and they're like, that's so cute.
They're less relaxing at 5 a.m. in the morning when they start to have their, I don't know, morning announcements.
Yeah.
But it's still nice.
Yeah.
All right, I would say let's get started. Welcome back, everybody. It is my pleasure to announce our next speaker, Noeska Smit, who already gave a wonderful primer on biomedical data sources on Monday. And her talk today is about multimodal medical visualization. So we had a little bit of a schedule switch. Noeska Smit is an associate professor in the visualization research group at the University of Bergen in Norway. She's also affiliated with the Mon Medical Imaging and Visualization Center as a senior researcher at the Haukeland University Hospital. And currently she's researching novel interactive visualization approaches for multimodal medical imaging data. Her current focus in this context is on multi-parametric MR acquisitions. So thank you, Noeska, and please go on and take it ahead.
Thank you so much, Johanna, for the introduction again. I've been introduced by now, I think at least 4 times. So I refuse to do another About Me slide. So if you missed it, you have to catch the Monday talk. So yeah, today I will talk about multimodal medical visualization. And as you just heard, I'm filling in for Katja Bühler, who was originally scheduled to give a talk about correlative biomedical imaging. And I just wanted to point out that it's very unfortunate that we're missing the lecture by Katja, because she has quite a different research focus than myself also. So in addition to knowing a lot about medical imaging data that I typically work with, like data from CT scans and MRI scans, she also knows a lot about microscopic images and how issues with trying to correlate images from different microscopes also arise and how to resolve them. So if you're interested in that, I encourage you to look up her research at her group in BioMedVis. But getting to the point of the lecture, today I will be focusing mainly again on the medical imaging part of multimodal visualization. Maybe taking a step back again and thinking about visualization, often you're dealing with going from data to images, right? Because the point of visualization is to provide visual encodings of data in order to gain insight for the users looking at the data. And it can look something like this, where you have a table of data and you're making some charts out of it. That is one form of visualization. But then you might be thinking, well, if you're working with medical imaging data, it's actually already images, and you'd be right. So medical imaging data is often spatial in nature. It's very often scalar volumes that you can work with, as was also shown in the volume rendering lecture by Stefan Bruckner. Another special thing about the medical imaging data is that there's quite a comprehensive standard for how this medical data should be stored. And this also has some metadata that tells you something about how the data was acquired. But this standard makes it also nice and a bit easier to visualize than when you have all these vendor-specific formats that you might be locked in with, right? So it's a good thing we have this DICOM standard for medical imaging. Like I said, the data is already an image. So does that mean we're done visualizing? Well, no. For example, when you have a CT scan, as you've already seen before, you can do volume rendering in order to come up with different visual representations of the same data. And here's some more examples of that, right? So you can take this stack of CT slices, see it as a scalar volume, and then do something called direct volume rendering to come up with even nearly photorealistic representations of this data. So the images shown here on the right are rendered in Exposure Render, which is also an open source tool that you can download and play with if you want to. So if you have any CT scans of yourself lying around, I obviously hope you do not, because you typically have them taken when you have a disease, but I encourage you to try it out and to render them in the software to see what it looks like. So like I already mentioned, you can do indirect volume rendering and direct volume rendering. In direct volume rendering, you're not doing anything special to the volume except determining a color and an opacity and the transfer function. Then you can do volume rendering already, that is shown here on the left. And on the right, we have an example of indirect volume rendering where you first reconstruct the surface and then you're rendering that. So that's all good and well. By the way, if you want to try this out for yourself and you've never done so, I've written together with Jan Bischka a short peer review tutorial, which is linked here at the slides, which I'll be sharing after. So if you're interested in giving it a try, there's a small data set and also some instructions for how to do this. All right. So covered so far actually in the course is already quite a lot, right? We've seen scalar fields, which are volumes of voxels, so 3D pixels, which have a single value. That could be an intensity value if you're talking about CT images in particular. Then we've seen tensors and DTI data, where you have a full sort of matrix per voxel. So that's very a lot of information in this type of data. Anna talked more about diffusion tensor imaging. Then just now we've seen Ingrid talk about flow. And I quickly stole this image for to illustrate the flow. This is the benefit of doing very late lecture preparation, right? So you can steal images from the other speakers. But that is actually not entirely the topics I will talk about now, because now the question is, what do we do if we have multiple medical imaging modalities, right? So we've seen this slide before also on my Monday lecture. You can have through a variety of acquisition methods, for example, using the magnetic field in MRI or using a rotating CT scan, CT X-ray tube in CT. You can have a variety of imaging contrasts. And the cool thing about this variety is that they highlight different features about the tissue that you're imaging. So it could be, for example, that in one of the modalities, you see a lot about bodily functions, like, for example, in this PET scan that we also heard more about on Monday. And in the other ones, you can see a lot of structural or anatomical information, for example, in CT scans. So what can we do if we want to combine all that? Well, this is sometimes referred to as multimodal visualization. And I wanted to clarify something a bit at first. The terminology that is used when talking about multimodal medical imaging varies a little bit. So some people, they will use the same word to mean different things. And I just wanted to give you an understanding of what I will mean when I talk about this in the following. So when I say multimodal, I really mean from different sort of hardware or scanner types, right? So an example of multimodal would be combining information from PET scans and CT scans, right? That would be multimodal because it's different scanners, even though they can be also in a single scanner, so in a hybrid scanner, as I also said Monday, as a PET CT scanner. This would still be different acquisition methods that are gathering different types of information. So this is often referred to as multimodal. Then another term that you frequently hear is multiparametric. And here in medical imaging, this is often used when it's from the same hardware. So I already mentioned also on Monday, if you have an MRI scanner, you can tweak the settings, so the echo time, the repetition time, and tweaking these settings will lead to different image contrasts. And that means that out of a single device, you can really get a lot of information. And these different information also result again in different volumes. So in a way, you're still combining different scanning volumes together, but it's coming from the same device. So for that reason, they also call this multiparametric rather than multimodal. Then other terms you may be hearing are correlative imaging. I notice this is very often used in the life sciences. So when people are imaging based on microscopes, they often refer to combining the data as correlative imaging. Multi-aspect and multifacet are other terms that you can use for such rich data. The main part of this lecture is actually based on a survey that we've written some years ago, also in collaboration with Katja, by the way, but also Kyla Won and Bernard Pijn. And in this survey, we took a look at what type of multimodal medical imaging visualization already exists, and also what are the techniques that are typically used in such papers. Notice that this is mainly centered around medical imaging data again, so not so much about any of the other modalities, either on a smaller scale, microscopes or things like that. It's really around the scanners that are in clinical use today. So actually here in this image, you see an example of very common multimodal imaging visualization. And this is combining a PET scan with a CT scan. What you see here on the left is what's very often done when they fuse the images together into a single view. So these are slice-based views that you're looking at here, the center one. And then you have in gray value the CT scan, and then the PET activity is shown as a sort of colored overlay. And because you're using now these two different visual channels, you can interpret both at the same time. Notice that you can only do that when there's not too much overlap. So when the PET is very bright, it might overlap with the CT in such a way that you don't see it anymore. On the left, you see a MIP of the full PET scan. So MIP, the maximum intensity technique, that's also something that was already covered by Stefan yesterday, that was, yeah. And on the right, you see a multi-volume rendering. So this is volume rendering again, but rather than traversing one volume at a time, you're looking now at both the CT and the PET imaging, and you're compositing both. Now, let's go a bit over what are the challenges when you're trying to visualize multimodal medical imaging data. The first challenge is actually similar to a lot of the challenges we've seen in any of the other lectures this week, and that is that there's too much information to show all at once, right? So when you're having two modalities, for example, CT and PET again, as shown here, the question is what to show. For example, you could put the most emphasis on the PET and only show a part of the CT if that is relevant. What is very often done is having the CT sort of as a backdrop to provide spatial context to the activity that's shown in the PET imaging. Okay, so now we have two modalities combined. But what happens if we do more than two? So if you want to show three modalities in this way, this becomes really challenging already. Also, while we have too much information, sometimes we also don't have enough information. Because if the structure of interest does not have enough contrast with the surrounding tissue, or there's many other structures in the way, you can get something which is called occlusion, right? Or when there's not enough contrast, it will become hard to isolate the part of the data that you're interested in. So at times when combining multiple sources, you would also need to do segmentation or labeling in order to do it well. So that is one of the main challenges when visualizing multimodal data. The second challenge that occurs is registration. And I also mentioned this on Monday already briefly, but in registration, you're basically having two volumes that are recorded in different ways or in different positions, and you want to align them in a way where you can overlap them perfectly. So here's an example also from previous work. By the way, I cite a lot about my own work, but this is mainly for copyright issues. So I have the imaging data available and I know the copyright is okay for the YouTube recording. So don't think that my work is the greatest and there's nothing else in multimodal. This is more a convenience thing, and in part due to the last minute preparation of this lecture. So sorry about that. Okay, anyway, back to the story. So we have this MRI scan and we have also an atlas of information that was acquired in a different way. If you want to align the two in order to enrich the MRI scan with some information from the atlas, what we need to do is register. And registration is nothing more than taking one volume, and here I show it at a slice-based level, and then trying to align it as best you can with the scan that is underneath. I think this is about the limit of my PowerPoint animation skills. I hope you appreciate it. So here you already see that this alignment in particular did not work very well. And why was that? Well, the types of scans are very different, and also the patients are different entirely. So you don't need this sort of rigid registration, but you need a deformable one. And a deformable registration really warps the image to fit the other one in a better way. Now there's software to do that. For example, Elastics is a famous framework you can use to do registration, but there's still some challenges associated. First of all, getting a good registration result is not always easy. If you have brain imaging data, it's a little more easy because the brain and the skull are quite fixed and let's say hard. So then it's not so squishy and moving around all the time. You're typically okay with doing just some minor adjustments. When you're trying to register soft tissue structures together, such as those in the pelvis, you run into a lot more trouble because there's a lot more deformation going on inside. If you have a hybrid scanner, however, one of those scanners that acquires both PET and CT at once, it's already a little bit alleviated, so there's less registration issue, but it doesn't mean it's solved because actually, like I said, also on Monday, there's some bodily processes going on that patients can be told to stop, luckily, such as breathing, and that makes the registration still a challenge. Another challenge is communicating uncertainty where the registration maybe did not succeed very well. So if you are showing two volumes aligned in some way, and you're not entirely sure about the alignment, you should really do something to make sure that people realize that you're not sure about the alignment, right? So here's another example of that. Here we try to visualize both uncertainty from a registration process together with a distance visualization. And we chose to put the distance into a color map. So red means close and white means far away from structures they want to avoid. And then we put the uncertainty in several other visual encodings on top. We did a little experiment here to look at what people appreciated most. In this case, it was surgeons looking at this data. And they really appreciated this visualization on the left, where you have sort of these half-tone dots showing the uncertainty registration process. A third challenge when it comes to working with multimodal imaging data is software. So when you're doing multimodal medical image visualization, those are long words. I should come up with a shortening of that, like an abbreviation that no one understands. Okay, anyway, it's not supported by all the software that is out there. So it could be that you're using some software to do your visualization already, but then the multimodal part is not supported and you need to look for something else. What is very often supported, at least, is these side-by-side interaction linked slice views, at least, that you can view or browse through the volume simultaneously. When you're doing volume rendering of more images, of more volumes, it's already more challenging, however, especially when you integrate a non-standard modality. So PET-CT are quite standard to integrate together, but there may be combinations that are not, or when there's a larger number of modalities involved. A fourth challenge you have is evaluation of the visualization techniques that exist. So while there were many visualization techniques developed and proposed, also working for multiple volumes and multimodal data, there's very few that have been thoroughly evaluated. So it's difficult to say what is now the best practice in rendering multimodal medical image visualization because there's no data on this. So as always, when you're evaluating a visualization and how well it works, you need to think about data, users, and tasks, right? And Bernard Prime will be later this week talking also about evaluation practice in MedVis. So I'm looking forward to his lecture on this as well. Then the fifth challenge is really one that covers a lot of ground. I try to make it only 5 challenges and not like 10 or so. But there's multimodal, as we have spoken about so far, which is when you have multiple images from different scanners. But there's also more multi things going on that you can think of. For example, when you have time varying data, such as functional MRI scans or dynamic PET, how do you show that in a meaningful way? When you have cohort data, so it's no longer a single patient that you're looking at, but a whole bunch of subjects together. And maybe they have received some scans over time. Also, this multi-scale is a big challenge, as already discussed by Helwig yesterday in his wonderful lecture. And then there's integrating spatial and non-spatial data visualization. So I've been working mainly in spatial data visualization, and there's others that have been working mainly in non-spatial data visualization, for example, visual analytics for healthcare. And the meeting of the field so far has been limited. I think Niels Galenborg yesterday, was it? the day before yesterday. I don't even remember what the days are anymore, but he had a very nice example of this spatially resolved omics information that he was showing. So when you think about challenges in visualization, sometimes there's challenges at different levels. For example, there can be technical challenges, which are kind of the size of the data. When you have one volume that is 512 by 512 by 512, then might be okay for your graphics card. When you have 5 of them at the same time, you need to start doing some tricks in order to make it efficient. Multi-volume rendering, however, has been heavily researched, and there's many great papers on that. Also, some of them referenced in the survey that I mentioned earlier, in case you're interested in that. You can have a set of challenges that are more practical. For example, lack of software support. This is in part due to the incentives that we have in academia to develop software, right? So when PhD students are developing software, it's very often only reaching the prototype stage. And that is because the incentive structure is resolved around publishing papers and not so much building a complete software framework. It could be also that it's an unsolved challenge. So it's not entirely sure yet, according to visualization research at the time, what is the best approach for this. And I think the latter type of category is something that you want to target in your PhDs if you're considering those, or maybe in your master thesis. Because while the practical ones, such as issues doing registration of your data, while they're annoying, they probably won't lead to so much visualization research contributions when you address those, at least in my experience. All right, now that we've seen some open challenges, maybe we can also take a look at what techniques are out there, which are commonly used to target the issues. Just repeating a bit, what are the issues when you're rendering multiple volumes together? The first one is occlusion. And occlusion is when structures are overlapping and kind of blocking the view on something else. So you can have it in 3D, as you see here on the right. The green one is on top of the blue one. But you can also have it in 2D already, where the path activity here is blocking the view on the CT scan. Another challenge is depth perception. Because if you have multiple structures like we have here on top, you might think, well, why not make them see-through? Problem solved, right? Problem is not so solved, because now I don't know if the blue one or the green one is in front, right? Unless I start interacting and moving with the data. The third challenge is what is called visual clutter, and this relates to the too much information. So if you have, for example, a brain scan and you want to show also some lesion information inside, together with some DTI, together with brain parcellation information, you're ending up in a situation when it just becomes too much, right? There's a visual overload, you don't know what you're looking at anymore. Okay, so luckily we have some techniques already out there to address these challenges. And I think choosing the right one and combining them in a meaningful way for your application is very interesting to focus on. For example, maybe you've heard before of focus and context visualization, where you're treating some information in a volume differently than the rest of the information. So your focus structure, you're rendering in a specific way, and the rest of it in sort of a context way. That's what the name says, I guess. But you can use that for multimodal imaging as well. So for example, you could render one modality in one style outside of a focus area. For example, here, you see the arm. And then inside a focus area, you can choose a different visual representation or even a different volume, right? So that gives you sort of a magic lens impression of the insides of the data. Another technique you can use is illustrative visualization. And here you're abstracting away details by using illustration-inspired visual encoding. So for example, here we have a rendering of a vascular tree, I think in the liver, and we're trying to encode the depth in a way where you can see the depth at a single glance from just the type of shading it has, and also these sort of anchors that anchor it to a plane. So here the details of making a realistic looking vessel are obscured away kind of and replaced by something that can still encode the information, such as distance here in grayscale, and at the same time give you a good perception of the depth. Another technique you can use is ghosted views. And in ghosted views, this is a sort of a special shading which enhances the shape perception, but at the same time reduces occlusion or overlap through transparency. And on the right, you see some work from Helwig Hauser, who presented yesterday. And you see sort of the skin of the wrist is rendered in a transparent way, but you can also still see the edges highlighted. This is the ghosted view technique. Here we see it also on the left with these two objects as shown before. So normal transparency, you don't see which is in front, but with the ghosted view, you get a far better perception of the shapes. And adding something like a halo on the outside can further help you sort out the depth sorting issues. Another technique you can use is called cutaways. And here, when you use the multimodal data, you can use that to remove one modality in part of the volume. For example, on the left here, we have a brain again, and it's rendered in sort of an illustrative way where you see some brain parcellations. You have a ghosted sort of view, or sorry, a transparent view on top because the brain is sort of cut along this plane. And you have DTI tract fibers inside, and at the same time, you're even showing some fMRI activity, right? So here you're removing a part, you're still giving some context, only to show this fMRI region highlighted in a nice way. This is definitely not new, these cutaways. It's been going on for a long time. And one of the papers that continuously impresses me is one of the first volume rendering papers, actually, that was already multimodal. I think it was combining CT and MR images. And here we have an MR angiography of the knee. Or sorry, an MR of the knee, maybe with a CT angiography. I'm sorry, I don't remember the details. This is due to limited lecture preparation time again. I have a nice article on this paper also on medvis.org, which I'll link to later. But already in '88, people were doing these cutaways. Isn't that amazing? I was 5 at this time. So cutaways have been successfully deployed for a very long time, is the takeaway here. All right, now given these techniques, you may be wondering, that's all great and well, can we see some examples as well of multimodal medical imaging research? Yes, we can. And again, let me just be clear, I picked them from my own research and background because that's what's available and I don't have copyright issues, but there are many others, partially also covered by our survey of some years ago. So please check that out if you're looking for more information. So here's some early work that we did on visualizing PET-CT information at the same time. You've already heard of that you can do this MIP, this maximum intensity projection. But what you immediately see from this image is that the depth is completely taken away, right? It's a projection where everything is flattened down. And only through interaction can you get the depth back. So for example, is this PET activity here in red, is that in front of the ribs or behind? Who knows, right? Because it's all flattened out. If you do standard multi-volume rendering, you see the depth a little better, but you're suffering from occlusion. That means that structures can get in the way of other structures. And here's then an approach we developed some years ago where you can both look inside the body and see the outside in an illustrative way. And if you see it in motion, I hope Zoom will allow this. If not, I can send you the separate video also later. If you see it in motion, then you see that you always have a view on the PET activity. And at the same time, you don't have the depth perception or occlusion issues from the standard techniques. All right, I have another example to show you, which is related to this multi-parametric imaging in endometrial cancer. So our collaborators here in Bergen at the MMIV, they're working on gynecological cancer imaging. And what they're often doing is they're having these standard MRI acquisitions like T1 and T2, but they're also calculating some other features out of this data, so-called parametric maps, which give you some information about the tissue properties. Now, if you want to see everything at once, then you might run into trouble because you have to go left, right, and you have to see, spot the differences here and here and here. It's quite difficult. So we came up with a way to have a sort of an interactive visualization where you can explore all of these volumes at once. And the way we did that is through a combination of a volume rendering and a sort of spherical probe that allows you to sample across these multi-parametric data sets. And then we use the technique from information visualization called a radial plot to show the information that is inside of these spherical voxels. And in this way, you can use it for example, comparison of tumor tissue versus healthy tissue or comparison between patients. So here now on every axis, you have one of these parametric maps. And now we can see the differences, for example, between these orange and these blue spheres is that they differ a lot in the K12 trends. K12 or K-trans modality. Here's a little video of that as well. Because the power of this is really that you can do it live and it dynamically updates. Also, it's running in the browser, which is pretty cool. It's also open source, by the way. I shall add in the link before sharing this further. Anyway, what you're having here is this combination of volume rendering and sort of information visualization to assess features that are hidden in your data. So now we no longer need to look at all of these images side by side. We can simply sample them as such and use the images in addition if you want to. This even allows us to see similarity views. So if you place such a sphere and you use that as a basis for a transfer function where you're looking for similarity across all modalities, we found that it turns out to highlight metastases, so cancer spread, right? So here we place one sphere inside the tumor and then two more metastases are highlighting. And if you look at the individual modalities, this is not immediately apparent. And this is something we're still investigating further with our collaborators. If you want to know more about this tool, my PhD student Eric Murth has made a great YouTube video with very fancy video editing, if I do say so myself. And it's on YouTube if you want to watch it. We've also worked on combining multimodal visualization with more cohort data. So here we're looking at a whole cohort of gynecological cancer patients and their multimodal images. We're looking at radiomic tumor features which are extracted together with information that is available from a biopsy. So here we're trying to combine spatial and non-spatial imaging features and non-imaging features in a single cohort analysis tool. I invite you to look at the paper if you're interested in that. I think I'm almost out of time. Let me briefly check. Yes, 1 minute left, I think. Okay, some closing remarks very quickly. There's many open challenges with multimodal medical imaging data and also the combination of other medical data and biological data that is out there. And there's some software that already supports it. So Slicer3D does a pretty good job of it. And you can read more about it. Also, if you're looking into PET-CT, for example, in the link below. I also wanted to point you to medvis.org. This is a community blog that we started some years ago. It's been less active since I finished my PhD, but if you have any contributions to share, you're most welcome to contact me. But it already has an overview of some publicly available data sets, software, research groups that are working on medical visualization and open job positions. So please join us and let me know if you have anything to share. Also, this MMIV Center that has been referenced now several times. I just wanted to say that we're having an annual conference again in December, and you're most welcome to join us there as well. Thank you so much for your attention.
Thank you very much, Noeska. Great talk. All right, so we have time for 1 or 2 questions. One question on Discord is regarding the registration. How do you integrate multimodal images if they're taken at different position and orientation? Are there any ways to account for the errors?
Yes, so you would need typically dedicated registration software for that. So for example, Elastics is a very good tool that does that. But you could also build your own using ITK, the image processing toolkit. I think it's short for, it's related to VTK, right? But the errors, you need to take care of them because if you don't show them, you may make very misleading visualizations. So certainly important to take a look at those.
All right, thank you. I actually also have a question. I was just wondering, do you have a sense how common is multimodal imaging in medical practice? Is everyone using it, or is it like kind of rare that doctors are using it? Do you have a sense?
I think it's becoming more and more commonplace. Also, here at the Hogeland, we used to have a PET-CT scanner only, but recently acquired also a PET-MR hybrid scanner. And also, even if you have a standard regular MR machine, just this multiparametric imaging is very commonly done just to get different types of information from the same scan. Yeah.
Great, thanks. So there are a couple more questions on Discord, so maybe you have time after this talk to check in with them and answer the questions. Sure, thank you again, Noeska. Really nice talk.